honored to have you here to share your insights and expertise with us. Julz, please take the floor.
Thank you so much for that introduction, and thank you, Visiting Angels, for setting this up. Barbara, good morning. Uh, uh, Lead Director of Development and Community Services at Visiting Angels, and all the other wonderful people at Visiting Angels. And good morning, caregivers. I hope today finds you all well. So my name is Julz. Everyone knows me as Julz. I'm the Respite Administrator with the Arc Montgomery County. My contact information is here. I'm just going to go briefly about respite coordination. So the Arc of Montgomery County has been awarded the contract to administer and coordinate the system of respite for Montgomery County caregivers. Our primary funding source is Montgomery County's Department of Health and Human Services. So just in case that our audience doesn't know what respite is, the word respite means to take a break. So you're taking a break from caregiving. Respite provides you short-term temporary relief that can ease the burden of family caregiving to help relieve stress, restore your energy, and promote a healthy lifestyle. Just keep in mind that respite is not designed for ongoing care, but just to give you a break. Eligible. The Arc of Montgomery County can provide short-term respite care for a full-time live-in primary caregiver who resides in the same household in Montgomery County. And a full-time primary caregiver could be a parent who's caring for a child with autism, a parent who's caring for an adult with an intellectual disability, a spouse caring for a spouse. These are some of the caregivers that we have enrolled in respite. The eligibility requirement is that you have to live in the same household, caring for one of those populations. And we define a senior as 60 plus, okay? And there is no income requirement to apply for respite. That is the main requirement, that you have to demonstrate that you and your loved one that you're caring for reside in the same household in Montgomery County. That's basically it. A lot of people find that very hard to believe, but that's what we need. And you would be eligible for 140 hours in a fiscal year. It's not a lot of hours. Some families choose to use their hours right up front. Some families try to stagger it over a year. It's really up to you. And you can use your respite hours in different settings. You can use them with a home health care agency that's part of our consortium, like Visiting Angels. Visiting Angels is one of our popular agencies that many families choose from. They are also very active in the senior community as well. We do a lot of community outreaches together. We have some families use their respite hours in an adult medical days program, and we work with the majority of the adult medical days in the area. We also work with respite facilities, so we work with Sunrise, Arden Courts, Alney Assisted Living, Serenity Gardens, JK House of Grace. Some families choose to use their respite hours to go on a week's vacation with other family members because their loved one are not able to go on vacation and they need someone to care for them. We also provide respite to parents, and they can use their hours at camps or therapeutic programs. So how do you apply for respite? The application's on our website. We have 3 different applications: children's, adults, and seniors is 60 plus. Just a little bit of data. Our oldest client being served is 106, and our youngest is 2 years old. Our oldest caregiver is 93 years old, taking care of her spouse. It's 98 years old. Right now we're at capacity, meaning that we have enough people enrolled in respite for our funding limitations. And also, this is renewal season, so every family that's enrolled in respite has to renew their applications. So we're working on that. But you'll be able to visit our website on July 5th, and the application is out there. If you need any assistance with the application, you can call our office. We'd be happy to help you. But Visiting Angels has a team of people that also can assist in helping you fill out the application. I know they've gone to some homes. They will help out in the community outreach. They'll do whatever it takes to help you fill out the respite application. And then once the person is enrolled in respite, I provide them with a family orientation to basically go over the guidelines of the programs. And then I try to match them up with a home health care agency or respite facility that would meet the needs of their loved one. And the family can choose from a consortium of home health care agencies, respite facilities, or adult medical day. But I'd like to touch upon our home health care agencies. In Montgomery County, there's around 200 home health care agencies, maybe more now. We don't work with all 200, but all our home health care agencies, like Visiting Angels, have what's called a residential service agency license in the state of Maryland. They have license and they conduct in-depth background checks on their employees. So that's basically respite in a nutshell. So I'll be happy to take any questions.
All right. So yes, we got a few questions here. Kristen here and saying, please share website for application on chat. I was not able to copy it down in time. Can we share that in chat, please?
Yeah,
The
you
website
can.
for
But again,
application.
the application is not available. It'll be available on July 5th.
July 5th.
We've closed our application. If you're enrolled in respite, if you're already enrolled in respite, you get a renewal application in the mail. You cannot get it on our website. That's one of the reasons we take it down, because families already enrolled have a priority to fill out an application before new families are let in. That's why we take the application down, because we have an enrollment period and we have a renewal period.
Mm-hmm.
So Wanda, you'll be getting yours in the mail, and anyone else that's already receiving respite will get it in the mail. We'll email you that we've mailed out your packet as well.
Okay.
And I encourage any family that's on the call that's already enrolled in respite to renew your applications. Unfortunately, each year, it's unfortunate, but it is fortunate. We have new families applying, and each year our program is growing. So if you don't renew, we will close your file. It's super important to renew.
Mm-hmm. Okay. Mary Beth is asking here, is there a Baltimore County contact for respite?
I will, if you give me, each county is a little different. But Baltimore used to be served, they changed it. Is it Baltimore County or Baltimore City?
Baltimore County.
Unlike Montgomery County, most other counties in Maryland have a Department of Social Services. And for Baltimore, you would want to call the Department of Social Services for Baltimore County and find out how their respite program is. Each county has different funding sources. So what they have in Baltimore County may be different than they have in Montgomery. Okay? Some counties receive only state funding, and it's not that much. Other counties, like Montgomery County, receive county, state, and actual federal funding. So it's a little different when you go out of Montgomery County. But the best thing to do is to call, they have a 311 number. It's called, and you could dial BALTCO 311. BALTCO 311. Let's see, I'm trying to get you, let me see if they have a adult services number. It's Department of Aging. Maybe a better number. A lot of respite programs in Maryland ceased during COVID. And this is this number right here is for the Baltimore County aging program. That's the 410-887-4724. That's more of a direct number than the 311 number. The 311 number probably just go into an automated system. So I was able to find the 410-887-4724 for Baltimore County. They have a aging department. And again, for PG County, like Baltimore County, you have to call the Department of Social Services, and they'll direct you to their website to fill out an application, or they'll tell you if the funding is available.
Still thought maybe we would talk about the qualifications. Just kind of review those a little bit, please.
Okay. You must be a full-time living caregiver residing in Montgomery County, caring for a loved one that's a senior, a child or adult with a disability, a child or adult with challenging behavior, a child or adult with a functional disability such as MS, lupus, diabetes, stroke, HIV. That's considered a functional disability. The majority of people enrolled in respite are Montgomery County residents caring for a senior. Usually it's a spouse caring for a spouse, an adult child caring for one of their parents.
Someone is asking here if there's an income limit.
No, there is not. When you go to our website on July 5th, the application will be there. If you're a caregiver caring for a senior, 60 plus, you want to get a senior application, or if you're and you'll see that on the application there's no income requirement.
All right. Beth is asking if they can see the application before July 5 so that they can see
No.
the documentation needed.
No, unfortunately, you can't. I could tell you what documentation you need. Okay, well, again, one of the reasons we do not keep it up is we have families that are already enrolled in respite and they have to renew each year. It's a requirement of the contract with the county. So we can't put it up there when we can't have people renewing and applying for respite at the same time. Okay, so the requirement is you must be the primary caregiver caring for a loved one residing in the same household as the person you're caring for. Few examples: a spouse caring for a spouse, so a senior caring for a senior, a parent caring for a child with autism, a sibling caring for a sibling with MS, all residing in the Montgomery County household. You must reside in the same household, and you must be able to demonstrate that with a Maryland ID, Maryland license, Social Security award letter. We don't need any information about the income. You could redact that, or Maryland tax statement. You could also redact that. But those are the requirements. That's what you need. And then there's a whole bunch of information we ask you about your loved one, your home environment, medical needs and medical support. We take that application and we enter it in our database and we create a profile. That profile is then sent to a vendor. Once you've selected a vendor to provide respite, is then sent to the vendor. So they have an idea of what kind of support your loved one needs. And then the agency will contact you to set up a meeting, and they have to do what's called a nursing assessment. So the nurse will come to your home, do an assessment of your loved one, and then that nurse creates what's called a plan of care. So any aid that comes into your home from Visiting Angels or any other agency you provide, the aid must follow that plan of care.
Julz, maybe if you could do like just a simple checklist for them, some of the tools that they'll need to fill out the application, like either a driver's license or Montgomery County ID. You did mention something about the doctor getting the stamp on the particular form, but just as some basic checklist for them,
Yeah.
that if they don't have it in place, it takes time to go to the DMV to get, the IDs and things, but just give them a head start.
Yeah, I see someone's already put that in there. So, the question was, so we apply for respite, but the ARC doesn't provide the respite. That is correct. The ARC of Montgomery County administers and coordinates. So we help with the application process, we provide you an orientation, we connect you to, our consortium of care, which is made up of home health care agencies, respite facilities, adult medical day. And for our children, they can use their respite hours at camps, a therapeutic program. But you have to go through the ARC to apply. So anybody that wants a subsidy for care must come through the ARC of Montgomery County. Now, in other counties in Maryland, it works a little differently. Okay, so basically the county awarded, puts a contract out there, and the ARC has been doing it for 25 years. And then we pay the vendor directly, as long as the vendor accepts our rate, and Visiting Angels does accept our rate, and then we pay Visiting Angels directly. I do want to give you some information about in-home respite. It's limited to no more than 10 hours a day, so meaning that we cannot subsidize anything over 10 hours a day for in-home respite. If you need more than 10 hours, you can use that. You can certainly request that from Visiting Angels or the provider you choose for in-home respite. However, we can only pay up to $10 an hour. Most families that are enrolled are considered level 1, which means non-skilled nursing. So Visiting Angels or any other agency will send you a certified nursing assistant or companion care. They cannot administer medication, so that's really important. Respite does not allow for transportation. If you need transportation, you could talk to Visiting Angels about that, but we cannot subsidize a payment for transportation. The aide can accompany you. Many caregivers need assistance to take their loved one to the doctor's appointment, and the aide can accompany the family, but they cannot transport. You can certainly ask the agency if they can. There was what about a child with hemophilia? Yes, we actually have another family enrolled that has a child with that blood disorder, and we do support them. The children's application is a little more in depth. We require some formal documentation, an IEP as well. My parents would work 4 days a week. So, you live with your parents, which, okay, most caregivers, well, I don't want to say most, we have a lot of parents that work. And they still are the primary caregiver, but they have to go to work, but they use their respite hours for other things like camps and therapeutic programs. But if you have a paid caregiver, and I could talk about who's not eligible. So any family that's receiving the community first choice waiver is not eligible for our program. Any family that's receiving any kind of Medicaid waiver, whether it's autism waiver, community pathway waiver, community options waiver, or the community first choice waiver, or veterans respite, is not eligible for our program. Our program is designed for families who have little to no services. And keeping in mind, you're only eligible for 140 hours. So if you want to, if you're planning on using respite hours to go to work and you work full time, this is not the program that you need. Respite is designed to give you short-term temporary relief, so you take a break from caregiving. So what do people do when they take a break? I get that question a lot. A lot of people don't know. I don't know what to do with myself. I've been taking care of my loved ones so long. Well, many families will go use their hours on the weekends to attend services. Then they may have brunch with their friends, then take the time to do some shopping. Sometimes during week, caregivers need to make their own medical appointments. That's what they do with their respite hours. Some families have rejoined their course club or their book club that they had to give up because they were full-time caregivers. So I'll work with you to, and some families actually just sleep. They're taking care of a loved one with dementia and they're up all night and they are up with them. and they're exhausted. So while the aid's there, they take some time to take a nap and get refreshed. So everyone has different needs. What
Yeah.
is veterans waiver? It's a veterans respite program, and I'll let Barbara talk about that a little bit more.
Yeah, I'd be happy to do that. The Veterans has a respite program as well. And that's not limited to Montgomery County, just if you are a veteran, that if you have served your time during wartime. And I could, we actually have information I can go over with you on that, but that is for home health care and also a respite program they have available for someone taking care of a veteran in the family. But you can't mix the both of them together. If you are a veteran and you are in need and you have not registered in the respite program, please get with me. I'll put my email address in the chat and we might be able to get you started. And then at that time, if you don't have your veterans in place, you can apply for the respite. But then once the veterans kicks in, then you have to step out of the respite. You can't double dip into two government programs is basically what it's saying, but it does take time to get set up in the veterans. So it might be quicker to get into the veterans before, if you need something before July. Just depend on each circumstance, but I would be happy to share information with you on that. Let me put my email in for everyone to have.
Is Visiting Angels only for Montgomery County residents? I know Visiting Angels supports other areas outside of Montgomery County. Respite coordination that we're referring to is only for Montgomery County residents. There are other counties that do have respite programs, and we mentioned Baltimore and PG County. Howard County also has a respite program as well. Wanda, are you there, Miss Spence?
Yes, I'm sorry. Good morning.
Okay, Wanda, if you don't mind calling you out, Wanda is enrolled in respite. You want to just share how you use your respite hours?
Well, originally, I got introduced through Miss Barbara, was wonderful. And I started out with, I didn't understand the program. I wish that I had been able to get on a call like this when I first got in the program, but because this is really information and informational. So I got in, in the beginning, like Miss Julia said, I started out gung-ho, didn't understand those 140 hours. And I went yeah, I have, because I work part-time. I don't get a break, but I was using it for my part-time job to go to NIH for 4 hours a week. But I didn't realize, after you're getting in a rhythm and you don't realize how fast those hours go. So by the time 2023 popped in, I'm like, oh my God, what's happening? So I finally got that clear in my head. And when I started the new fiscal year and started again, I decided the second time was to spread it out, the 140 hours, to spread it out over the year. And that is seeming to be a hard adjustment as well, because granted, it's not a babysitting service. You all are doing an awesome job giving people those hours, but even still, even with the little bit I did from September to December, I ran out. I mean, it was running down so fast, and I was just trying to go to a course, and then I was trying to do 4 hours. And so anyway, you only get like what, 8 hours a month? Or was it 12?
About 11. It's a
little under 12. Yeah.
Yeah.
So you adjust it. You have to just continue to monitor it, adjust it according to your living arrangements and what you're doing. So right now I'm getting ready to run out again, I think. But I do have some time tomorrow, folks. I can't go to work. I'm just going to take the 4 hours and try to do something for Wanda, because I'm really, my mom has gotten 95. She's so fragile right now. She's having congestive heart failure, which is it's bad, but it's manageable, but it's made her weaker. So I know we all can talk about, I need therapy. It's all kinds of things. However, but that's how I'm using the hours. So you may have to start out with being aggressive about your time and what you do, then you may have to adjust. But just be mindful, that 140 hours, look at your calendar and look at them, see how many where you really need it, and put those hours there. And that's, you know, and then be mindful. They do a great job with all the services. Every caregiver person that comes to your home is not always a fit. But then there are a few that will be a fit, but you know, so you just got to kind of manage all that. But other than that, does that help, Miss Julia?
Yes,
Explaining?
thank you, Wanda, so much. That was amazing. And that's what I tell families during orientation, like anything in life, you know, you've got to be a right match. And there may be, I love telling this story. Most families welcome a caregiver that engages with their loved one. But I got a call from a family member one day and said, I really don't like that caregiver. I'm like, well, everybody loves this caregiver. What was the problem? I was shocked. They talk too much. So each caregiver has to have a right match. Okay. And sometimes we're really the agencies that have a bigger pool, aides will most likely be able to fit your needs. Visiting Angels is really good about, you know, finding the right person for your loved one, and they do their very best. And I always tell families, if you're having a problem with it, you need to speak to the office. If that doesn't work, I'll be happy to advocate on your behalf. And then getting back to the hours, yeah, the hours go very quickly. Some families, even though it says in the application 140 hours, I say that during our family orientation, some families get confused and just think it's 40 hours every month. So it's very confusing. But Wanda, I really appreciate how you took the time to use your hours based upon your needs.
Yeah.
In the very beginning, you needed something right away. So
She did.
then she realized, like she said, that why I don't have these hours left. So it's a great program, but again, it's designed to give you a break. It's not designed for ongoing care. I wish we were able to give more hours, but we have limited funding and the county dictates how much funding we'll receive. So it's really important that families that are enrolled will send you a survey, and it's important to put that notes about, you know, how you can request for more hours, and everybody should write to their city councilman and their district, the county executive, and tell them the benefits of respite and how you'd like to see them fund more. That's really important. Of course, I advocate for more funding every year, but the county council likes to hear it from families. So that's super important. If you have the time to email your the county executive or the county council, please do so and let them know how important this program is.
Thank you for sharing, Miss Wanda. Give Miss Muriel a big hug for me. I know that you two are very precious in my sight. And that is very important, that what Miss Wanda said, you know, we do our best to match, but if you are not happy, please let us know. And, you know, sometimes it takes an adjustment for people to open up and let people in, you know, to their home and like, well, my daughter's the only one that can take care of me. But, you know, it's very important. This whole program is structured for caregivers. And I'll share a little story that my father was primary caregiver for my mom. She had Alzheimer's. And, you know, unfortunately, he's in northwestern Pennsylvania, which they don't have anything like this. You are so blessed to have this program. And I actually, you know, have people coming in to give him a break where he can go get a haircut, or he can go have coffee with the guys, or go play golf, you know, just something to get away. Because if the caregiver goes down, then the families have to make a serious decision. And these caregivers do not get enough credit. You can't pay them enough. It's mentally, it's emotionally, it's physical, and it takes a toll on you. So even if it's just getting in your closet and shutting the door for 10 minutes and just playing your favorite music, or deep breaths, or having a cup of tea, or taking a walk, please take care of yourself. It's like being on the airplane. They tell you to put your oxygen mask on first before you can help others. Please use this respite program as your oxygen mask to take care of yourself, because it's too hard to take care of others when you're struggling. We applaud you.
I'd also like to make sure we get everybody's questions answered. Let's see, someone asked, is we getting the application by mail? I don't know, that was from, someone's asking about the respite application. If so, if it is if you're getting a renewal, you'll get a notification by email, but the renewal package will be sent to your home, will be mailed to your home. Well, this was a great group of people. Thank you so much for being here. And I hope you all apply come July 5th. We look forward to helping you all. And I know the Visiting Angels team would be happy to help you. If you'd like to come in and you need assistance with the application, my phone number is there. I'll be happy to have you come into the office and help you fill out the application as well.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights. See you again next third Wednesday of the month.